It's now time for On the Line with Cheryl Wilkerson. The conversation will range from local dialogue to international. This show is meant to enlighten, inform, and to inspire. On the Line with Cheryl Wilkerson begins now.
Hello and welcome to On the Line. Your host, Cheryl Wilkerson. It's the holiday season, so if I haven't said it to you all, happiest of holidays to you and your families. Please don't stress out about things that are out of your control. Please don't worry about trying to make things so perfect. Just enjoy your family and just enjoy the reason for the season. That's my advice to you today, and I hope you take it. It was free. How about that? We have a great guest today. You're going to learn a lot today. Recommended, came to me highly recommended, and so we're going to get into the core subject of pain today. So many of us live with pain on a daily basis, and so we're going to find out what that is really all about. To that end, we welcome to On the Line today Dr. Winifred Bragg. She's an expert. How about this, you all? An expert in providing non-surgical treatment for injuries and pain coming from spinal and orthopedic conditions. So I love that part about non-surgical treatment because, you know, everybody doesn't like going under that knife. So welcome to On the Line, Dr. Bragg. How are you?
I'm doing fine, and I'm glad to be here today with you, Cheryl.
Well, thank you for taking the time on a Sunday morning. We appreciate it. Tell me this. Give me your background. Where did you go to school, and why did you go to school where you went to school?
Well, I went to college at the University of Alabama. I grew up in Birmingham, Alabama, and I went there because that had always been my parents' dream to go to the University of Alabama. You know, their generation, they weren't able to go. So I was raised to know that that's where I was going to go. I went there for my undergraduate degree. I then went to medical school in Nashville, Tennessee at Meharry Medical College.
Yay.
And then I did my residency training at the University of Michigan. So I kind of went across the country from Alabama, Tennessee to Michigan.
Did you always know that you were going to go to medical school?
I didn't always know that. I grew up as being a gardener, just had a small garden, and I would be out in the garden talking to my plants and everything, and I told my dad, well, I'm going to do something with ecology or with plants. And my dad, who worked at Internal Revenue, said, I don't know anybody who's getting a job with that. If you can talk to plants, you can talk to people. So I kind of got interested in the health field. Initially, I thought I would be a dentist. And so I went to dental school for about a year, and I just carving teeth and making crowns and bridges was not my forte, but I enjoyed the patient interaction, the science and all of that. And so I said, hey, I'm going to go and be a physician. I had thought about physician early on, but as a woman, I said, dentistry is shorter. I'll try that. And what I learned is you have to realize that just because something is short, you have to do what you're passionate and what you love because you're going to do it for a long time.
And dentists, people may not think about it or it may not click, but I mean, they are medical doctors. Like you said, they're medical doctors. Yeah.
Yes, they are doctors, right.
They have different hours. I know a young man, he told me he was going to be a medical doctor and he changed and became a dentist. And I asked him why. And he said, because his father pointed out to him that it would be less hours as a practitioner if he were a dentist, because this was back in the day and people didn't do Saturdays and all of that so much now and extended hours. And so that's the route he chose. So that's interesting how you sit down and you think about what is best for you and what you want to do. And so you knew you wanted to go to medical school, but how did you decide what you wanted to specialize in?
Because in that time of when I was doing the transition from dental to medical school, I had the opportunity to work 1 year as a disability examiner. And I didn't know that a person from college could be the person that decided a person's disability benefits. I worked as a disability examiner for the state of Alabama, so I would review medical records and give recommendations on what type of work people could do and that kind of thing. And I got to work with doctors during that process. And, you know, so many people get denied from disability because you hear people saying, I'm going to get my Social Security disability. Cheryl, that is very hard to get that Social Security disability. And so I wanted to pick a profession that I could help people rehabilitate themselves so they wouldn't have to think about disability, but they could think about their abilities. And so I decided to go into physical medicine and rehabilitation, which is my primary specialty, because that deals with people who have disabilities and their goals and their functions. And so having that job, I learned how to focus on how do I help people get back to work? How do I help them to get their function? And then because that specialty deals with people who had disabilities and function, it also deals with pain because that's one of the main reasons that people talk about when they have disabilities. So that led me to pain management. And so that's how I got into pain management.
So that job that you have, that wielded a lot of power is what you just taught me.
It did. And so what I say to people, sometimes you can be thrown to somewhere, and if you really take your open mind and do it and listen, and you can learn, and you don't know why you were there. Why did you do that? And, and even in doing that job, I met people who had collection agencies and insurance companies and other things, right? And I'm like, oh, God, why am I learning this? Well, now that I own my own practice, Cheryl, guess what? That taught me about collections, and that taught me about finances and stuff. And so sometimes along the way, you're like, why did I have this and why did I do that? And it may be 20 years later, and you put the puzzle together. And so I always tell people, you just keep picking up pieces. And somewhere along the way, you'll lay down and know that that piece fits into a puzzle, and it makes the complete package. So for me, I started off in dental school, and it wasn't what I wanted, but through that, so much I learned, because when they do studies on pain, guess what they always study a new drug with? The dental model. If they want to come out with a new drug for pain, 9 times out of 10, they're going to take patients who had dental pain first and try that pain medicine on them.
Wow.
Isn't that ironic?
Who knew? Who knew? And so graduating from medical school, but then teach me how you decided, because you could have become this fabulous doctor and worked for somebody else. So where does the entrepreneurial spirit come from that I'm going to be this fabulous doctor, but I'm going to work for myself?
Well, I went to Meharry Medical School, and that's a small medical school. And when you go to a small place, that means you get a little one-on-one instruction, and you can have mentors that can mentor you and tell you and give you direction. And because I went there, I wasn't just a 1 out of 200 people in the class. Our class had 65 people, so it was smaller. Mm-hmm. I was fortunate to have a mentor, Dr. Eddie Hoover, who's a cardiothoracic surgeon, who really took a liking to me and my abilities. And he said, you know what? I want you to understand that you don't want to be a doctor. You want to be a doctor that has impact on your community and on other things in life. And that's what being a good doctor really does. And so he kind of guided me and mentored me. And that's why I was able to do research with him, learn how to write books and how to speak. And then I knew then that I wanted at some point my own business, because then, I've worked for other people before. Mm-hmm. But when you work with other people, guess what? You got to do their hours. Hence, I may have to work Sunday and couldn't come on this show with you today because they would be telling me when I could work. So when you have your own business, you're able to do those other things that you want to do. And it all came because I went to that small place called Meharry Medical College, and Dr. Hoover put his hands on me and told me that a doctor can have impact on the community. And that's what he saw in me and mentored me. And I still talk to him even now.
I hope people love and appreciate Meharry. My mother, after my dad passed, my mom got remarried, and she got remarried to a man. And I ended up taking care of them. So I'm going to the mailbox every day. And all of these letters from solicitation would come to him. And I remember Meharry was one of them. And I asked him about it one time because, it was nothing for a month. It'd be 20 different solicitations. And he said, I just like giving back. He said, especially to our HBCUs. He had gone to Virginia Union. And that's what he did. And I just always remembered him stroking a check to Meharry.
That's right. And that's why we need to give back to, like you said, HBCUs, because when you go there, you can get one-on-one individual attention, and you can get to see people that look like you that can become more than just a something, but a somebody. And that's what they do for you. And I think that combination going from, University of Alabama, where you're 1 out of 400 in a chemistry class, to going to a small place you can get molded, and you can get on what, for lack of a better word, get on the potter's wheel, and they can wheel you if you have the desire and motivation to want to be more, and you don't have to get lost in the crowd. And so that's why we have to give back to the HBCU.
That is exactly right. Let me ask you this. In a day, suppose somebody comes to you and they say, "Oh, Dr. Bragg, my back hurts." And then the next patient comes in and says, "Oh, Dr. Bragg, you got to do something. My head is hurting." And then the next person comes and says, "Dr. Bragg, I'm so glad you're here today. I'm so glad you let me in, fit me in your schedule, because my leg is hurting." If everybody walks to you and says that same thing, is there some common denominator that you are instantly going to think about? Or before you delve into it, is it something that just comes to your mind instantly in all three cases, even though it's different parts of the body?
Well, one thing I tell people, pain is different than other things. If you go to a primary care and you have diabetes, they can draw your blood sugar and know the blood sugar was high or low. If you go to somebody and your blood pressure is high, they can take your blood pressure. But pain is something that I can see you hurt, but I don't really know exactly how you hurt. And so what the limiting thing is that people need to be able to describe their pain. And so the first thing that I'm going to say in your head or your back or whatever, you have to tell me where it hurts, how long it hurts, and be able to describe the pain. And so a lot of people get their pain misdiagnosed because they don't come with information, Cheryl. And unlike a lot of other fields, or even with other medical fields, you've got to be able to give that history. So the first thing I'm going to ask them is, tell me where it is, how long you had it, so I know if it's a new pain, an acute pain, is it chronic, something you've been had, what treatment you've had for it. And then we do something called a pain scale. From 0 to 10, tell me how is it? And describe the pain as much as you can so that I can kind of see what you're trying to tell me about. And that's the common denominator, that the patient has to be able to describe that to me and let me know, is it a new pain or a chronic pain?
And do people usually, if you sit down and you start asking the questions, do they usually give you the answers, or do you kind of have to pull teeth to get there?
Yeah, I'm back to dental school again. You're right. I have to pull teeth.
Back in dental school again. Okay.
Back to dental school. You have to kind of pull teeth. And so what I have done on my website, and a lot of people don't take advantage of it, I took a chapter from a book I wrote on back pain, and I teach people the 9 questions that anybody needs, a step that you need to take to have a good visit with any doctor. And it's on my website, and you can download it, and it's going to tell you things that you need to bring. And so sometimes, doctors are busy like every other professionals. And so I tell people, if the plumber is coming to your house, you don't need to start talking about the stove if he's coming to do plumbing. If you start talking about the stove in the living room and the dining room, that's how people leave a visit not fulfilled, because they go all around the house. You have to let him know it's the plumbing, it's your dishwasher that's leaking, so you get that fixed. And so I tell people, bring to the visit with me. Tell me if you've had x-rays. Tell me who you last saw and what your treatment has been, so we don't have to duplicate the same thing. And so it is pulling teeth. But I want people to start writing down before they come to a pain doctor and say to you, like, Cheryl, you told me your leg, your head, your back hurt. Say it to your significant other, to your daughter, to your son, or to your significant other. My head hurts. And explain to him how it hurts. If he says, Cheryl, I don't have an idea what you're saying, guess what? I won't either.
So you can't look into a crystal ball and figure it out, huh?
Right. So it's no magical crystal ball. You need to come and write down one statement describing your pain, and that's when you're going to have a home run visit. When you can come in and say, Dr. Bragg, my head's been hurting for the last week. I did fall and hit my head on the table, and I've had a throbbing pain since then. It's about a 10. Boom, you got it. Or I was pulling weeds in my garden, and my back started hurting about 2 weeks ago, and guess where? It radiates down my leg. I got it. You just tell me, give me about a 30-second or a 60-second description of your pain. Don't go like some people. Well, Dr. Bragg, I've been had it here this 2022, and I saw a lady the other day. It started in 1969, and she came in for an emergency visit for something that started in 1969.
Wow. Are you able to help people like that?
Well, I am, but it's harder because I then have to pin them down.
Yeah.
So why are you coming to see me today? What made you want me today? And you've been getting treatment since 1969. What changed? And that's how I kind of get with helping with them. But it's more difficult when they come with something like that.
If you're just joining us today, I am speaking with Dr. Winifred Bragg. She is an expert in providing non-surgical treatment for injuries and pain that may result from spinal and orthopedic conditions. And she's nationally recognized. She's written books and all of that, been on ABC, NBC, CBS, Fox, all of that, board certified. I could go on and on and on. And she is also the medical director of the Spine and Orthopedic Pain Center in Norfolk, Virginia. And so can you, in one or two sentences, tell me what is pain? What is pain?
Pain is different for different people, but pain is when you feel something that's affecting you and limiting you from your movement, that's causing you not to be able to do your normal functions. That's what physical pain is described of. But pain can come from nerves, pain can come from muscles, pain can come from bones, pain can come from different generators and joints. That's why the description of what you're feeling is so important.
Is it possible that someone could be walking around with an illness, say maybe if it's a female walking around with fibroids or some sort of female problems, endometriosis or something, and that person's threshold for pain is so high that a normal person would have gone and said, "Oh, Dr. Bragg, I'm in pain. What's wrong with me?" But is it possible that a person has a high threshold and they're like, they don't feel it when the normal person would feel it, and that would allow the sickness to advance because they really don't feel it when everybody else would feel it?
You're right. Different people have different thresholds for pain. Some people, they can stump their toe and they say it's been hurting forever. So different people have different thresholds. And to your point, one of the things I want to bring out, that's why it's important to do your primary care visits and have your colonoscopies, your breast exams,
Yes.
and prostate exams. Because do you know, Cheryl, too often people come to me complaining of back pain. And sadly, on their first visit, when I work them up, it's cancer that is spread from their breast to their back or prostate to the back because they never had those preventative things, from their colon to their back. And that's a sad visit, that they ignored the pain. Now, that's the problem. Some people, like you said, have a different threshold. But what about those that ignored it and they didn't even realize that the back pain could have been a symptom of an internal problem, a medical problem that you never addressed?
I kind of go ballistic about people and certain things because I don't want people to go through agony. So one thing I can't put up with is don't smoke a cigarette. I'll tell a stranger on the street, put it down. I don't care. And they just look at me like I'm crazy and they're mad at me, but I don't care. But to my point, I don't have a father today because of cigarettes. But the other thing is, go get a colonoscopy, like you said. Go get your mammograms. I remember one man told me about the colonoscopy. He said colon cancer ran in his family. He had a colonoscopy one time. It hurt him so bad that he swore he would never have it again. And I said, pain or death? He says, no, I'm never having that again. Thank goodness a nurse called in and said, you can get sedated if it hurts you that bad. But I'm with you, Dr. Bragg. We got to get these people to understand that they've got to go to the doctor and do some preventive medicine. How about this? And this is kind of off topic, but does this make sense? You know how people go and get a colonoscopy or they go get a mammogram or whatever? Is there a certain age where you think people should just go to a cardiologist just to see about their heart? Their heart's been ticking for years. Just go get a checkup on the heart. Does that make sense or is that crazy?
Well, they could get that through their primary care if they're doing their primary care visits and they're checking their blood pressure and they're checking their cholesterol. From those markers that after, the primary care should be to say your cholesterol is high. We need to work on that. And the good thing you need to know There are good doctors, and there are people that were top of the class, middle of the class, but it doesn't matter where they graduated, but how much do they care about you? You don't care about how much you know, as long as you can tell that doctor cares about you. And you're right. So if your cholesterol is high, your blood pressure is high, your doctor keeps telling you that, and nothing is improving, then you need to say to your doctor, I want to go to a cardiologist. And most of the time, you may not even need a referral. You call the cardiologist and say, listen, I want an opinion with a cardiologist to check my blood pressure or my cholesterol because my numbers keep being out of line, and I want a specialist to check it. But a good primary care should be able to do that. By the same token, if you are 50 years old, 40, 50 years old, and colon cancer is in your family, and we know from the guy with Black Panther that he had colon cancer, what was he, about 39 years old? So that's why it's important to know family history. Sometimes we don't like to share in our families what we have, but it's not about being nosy. It's about being informed because guess what? We all have something in our families. We all have a deck of cards, and you have to play the cards you're born with. So if you know colon cancer is in your family, you need to go earlier. And like I say, you can ask and go to a cardiologist yourself and get that ticking heart checked. Because guess what? You don't have but one.
Dr. Bragg, you are so right. A girlfriend of mine told me all these years she had been thinking her grandfather died of so-and-so, and she went to a family reunion and realized that he really died of so-and-so. So when you're talking about that family history, you are hitting it on all fronts. I agree. You're right.
That's right. I saw a lady a couple months ago, and bless her heart, she's young in her 30s, and she has buried 2 siblings in the last 3 or 4 years. And I said to her, well, do they know why they died? She said, no. I said, well, did you all not do autopsies? She said, no, they didn't. Now, there's a place, some people have religious things about autopsies, and that's your own religious beliefs, and I won't get into that. But sometimes you have to step beside. I don't know that there's a verse, and I don't claim to be a religious scholar, that thou shalt not have an autopsy. I'm not familiar with that verse. Are you, Cheryl? But anyway, sometimes having an autopsy will give you information so you know why the person died. So it saves your family.
You're right. We are talking about pain today. So today, when most people come into your office, say they're in the 40 to 50 age range, what is the most common cause of pain?
Well, a lot of people are seeing me depending on what they do, back pain. Most of us will have about 80% of people are going to have back pain by age 55. So 40-year-olds could have back pain, but by age 55, 80% of people will have suffered from some degree of back pain. So some of that 40, 50, a lot of them come with what you call the tech neck, from technology, being at the computer, being on their phone, being at the computer a whole lot, and the way they're sitting with poor posture, they're going to come with spasm in their neck, running down their shoulder. That kind of hits that age group. And then when they get about 45, 50, some of them have a condition we call spinal stenosis. And you got that, Cheryl, when you go to the grocery store, and as soon as you get there, you want that grocery cart, and you're leaning over the cart.
Yes.
And when you stand up straight, your back hurts, and it kind of goes to your butt and down your thigh. You probably have a condition called spinal stenosis. Because when the Lord bless us to live to get a certain age, 45, 50, the canal in our back can get a little narrower and squeeze the nerves. And so the way we relieve that is we bend over. You know that when you're washing your dishes. And you don't stand up now and wash your dishes. You're kind of leaning over the sink. And when you stand up, it hurts you. You probably have spinal stenosis. So that kind of can hit that age group as well.
My brother and I, we have weird conversations. One conversation is, why do we go to grocery stores in certain parts, in certain areas, and the people are standing up straight pushing the carts? And we go to other grocery stores in other parts of the city, and people are leaning over the cart.
Well, you and your brother, we call that the grocery cart sign. And if you kind of look at those people's faces and see what age group they're in, they probably have spinal stenosis. And that's why they're leaning over that cart, to give them some relief, because when they stand up, the pain hurts, and it goes down their butt and down their leg and in their back. And so that's probably why they are doing that.
And it's caused by what?
Well, as we get a certain age, past 45, 50, the canal, the hole, where the spinal cord and the nerves come out, may have some arthritic or whatever, and it's narrow, and so it's pinching the nerves, and so that's what's causing the problem.
Are you seeing, we only have about 5 minutes left, but are you seeing certain types of pain coming from young people, say late teens and 20s? Are we seeing anything there?
Well, some people come with sports injuries. Some of them have knee pain from runner's knee and shoulder pain, and if that kind of thing is what we're seeing for them. Usually we see soft tissue problems with them. Some of them may have carpal tunnel a little bit, being on the computer a whole lot from their jobs, and just especially during COVID, sitting and being at home with Zoom meetings and being on the computer so much.
Would you, in the final 4 minutes, would you please tell people about your books and where they can find your books?
I have a best-selling book on Amazon, and it's called Knockout Pain, Secrets to Maintain a Healthy Back. They can find it on Amazon. They can get it from my office if they want to. They can also go to my website, knockoutpain.com, and they can and get a whole lot of information. I have articles on my website, like I told you, about the 9 steps that you need to take to make sure that you have a good doctor's visit. You can sign up there and get my monthly tips. I have a YouTube station called Dr. Winifred Bragg, where I give pain-free tips for a pain-free Friday, every Friday, Cheryl, so that people can have tips. If they're cooking a turkey, how they could cook that turkey and do this holiday cooking without hurting their back. And I'm going to give free tips. And so you can get it from my YouTube, and you can get it from my website, knockoutpain.com, and get the book from Amazon.
You are out here and you are doing it. I hope the listening audience realizes that I bought a real heavy hitter on today, and you are no joke. And how long are you going to stay there as the medical director of the Spine and Orthopedic Pain Center, right in Norfolk? How long do you plan to do that?
As long as God gives me good health. I don't know exactly how long I'll be here because, who knows what will bring. But I plan to be here for the next few years, and so we'll see how things go. And I have good health, and my patients have good health. They can find me at 757-333-3360. And right across from Centerally, and I'll be there and ready to help them with any musculoskeletal pain that they have.
And I'd be wrong if I didn't ask this one. If there's someone listening and there's a young person and they're thinking about going to medical school, what advice do you have for them?
I have them to make sure that they try to get some good recommendations when they are in college so that they can have that. I have a book that's unrelated to medicine called How to Create Your Bragg Book, because I'm all about people showing their own value. That's a talk for another day. But I think that everyone should know something about themselves that they can brag about, B-R-A-G-G. And people think bragging is bad, but I say that second G stands for gratitude. And as long as you do it from a standpoint of gratitude, young people, people will help you. But if you get that book, How to Create Your Bragg Book, it's going to tell you how to write things from your resume and different things that you're doing in the best flavor that's going to make you look good. And that's what that book kind of talks about.
And what advice do you have for the parents of young people that might want to become doctors?
That you encourage them to go for it. People are going to talk about how expensive it is, and it is expensive. But that mentor that I talked to you about told me that one of the things that as a doctor, you make a good salary in it. And if you keep on working, you'll be able to pay the loans back. So if you can't afford it, let them be able to get loans. I had to get loans to go to medical school, but I just kept working and chipping away at them, and then I was able to pay them and then have a good career. And that you want to look at what medicine allows you to do in your community, for your family, as a role model and all that. So parents, encourage them if that's what they want to do. It may be a long, hard road, and some naysayers may tell them that they can't do it, but why can't your child can't do it? They're part of you. You're good, and they should be able to do it.
I told you all, she's the truth. She's been featured on ABC, NBC, CBS, Fox. You can see why I've written all of these books. I sending out hugs and thank yous to Dr. Winifred Bragg, MD, today, specializing in that pain. Give out that phone number one more time, please, Dr. Bragg.
757 888-333-3360. Call us so we can try to knock out your pain.
Thank you so much. You take care, and happy holidays to you.
Thank you so much, Cheryl. Thanks for having me, and thanks to the listening audience for paying attention about their pain today.
All right, take care. There you have it, you all. I want to thank you all for listening. Another Sunday has gone by for us, but we'll be back next Sunday. In the meantime, you all take care. Happy holidays again, and behold the green and gold.